Hello, everyone. Good afternoon. Welcome to another update from your team here at Montgomery County. As always, so most of the time anyway, we have Jeff Smith, our sheriff, and Sarah Branco, our public health director, giving you, I guess we'd call the almost post-holiday update. A lot of similar themes as to what we've been talking about for the last couple weeks. Where we're at with numbers. And this, by the way, is day 289 since we had our first positive case. Um, we had another large increase this week, and it was for a total of 231. Just to give people a little perspective as far as where we've been and where we're going. In the last 7 weeks, the numbers, the weekly totals were as follows: 28, 78, 90, 128, 131, 218, and now 231. So we're still seeing an increase unlike anything we've ever seen up until just recently. Really, we haven't seen a whole lot of issues related to treating people and deaths, but this week we had 4 new fatalities. 2 were at nursing homes, 2 were, as we call, community-based. Obviously, that is one of the larger weeks we've had so far. There also were up on number of people that are in medical care, 18, which is up 4 from last week. We did have a call today with the St. Mary's Hospital, our local hospital, and I'll talk a little bit about that in a minute. Also, the governor did a briefing today at 11:30 that talked about where the Mohawk Valley is, and Mohawk Valley is ranking in the highest in the state for all the wrong reasons related to COVID. And the latest numbers for Montgomery County as far as the rolling averages. This is the latest that I have. I'm sure there's some much more recent numbers, but just to give you, and it's just a couple days old, a 7-day rolling average 8.9% and a 14-day rolling average of 7.4%. So when you look at that, obviously not good. In the call with the hospital today, and I would say Sarah was on, it was a very good call. We're staying in touch and trying to understand what they're going through, how we can help. But certainly the big points that came out of that was they're experiencing what is to be expected, which is issues with capacity and staffing, but they're twice a day working regionally in their network to try to make room, I guess is a simple way to say it. And they're doing a great job and doing everything they can. Staffing is very hard. It's very, difficult to find people that and to meet the needs. So they're on top of the issues. They're doing the best they can. But I think one of the big things that came out of that was, as we go ahead now to New Year's Eve and New Year's Day, we really need cooperation from the community to try to keep these numbers as low as they can be, and we need people to try to make good choices and try to essentially reduce your gatherings. The gatherings of 20, 30, 40, 50 people are just not going to make it any easier for the hospital administration, the hospital staff, the nurses. It's just going, if we continue to see these numbers go up, we're going to continue to see the number of people under medical care up. We're going to continue to see more fatalities, and likely restrictions. We know that the whether or not we go yellow or orange or red is going to really depend on capacity, and we're certainly pushing up against that. So it appears right now that January is going to be likely a very, very challenging start to 2021. I know we're all looking forward to putting 2020 behind us, none more than Sarah, but it looks like January is going to be a very tough month. And it's, again, I'm not saying this to scare anyone, or I'm just saying this is the reality of what we're facing. We're likely going to have restrictions. We're likely going to have, a designation, especially with capacity becoming a challenge. which is going to mean remote in schools and things of that nature, more so than it already is now. So we got our work cut out for us, Sheriff, but we're getting there. The good news is we've had a lot of good talks about the vaccinations and the different phases of that, and working towards a more widespread community vaccination when that becomes a possibility. But again, I'll stress to people this is a multi-month process. We're not going to get 80% of the population vaccinated by next week, but we're going to continue to work forward with that week by week. And yeah, I know I mean, just the sheer volume for your staff in public health is just it's becoming very, very difficult. But anything, Sarah, that I'm missing here? I mean, one of the big things is I did see there were some changes on quarantine.
Yes, so that was actually what I was going to talk a little bit about today. Even for us, things are changing every single day. The CDC had come out about 2 weeks ago and talked about the guidelines for quarantine be cut to 10 days to fall in line with isolation. And the state released this morning to us new guidance that from today forward, anybody that is an exposed person, so an exposed individual to a positive, that quarantine is now cut down to 10 days. It starts from today. It is not retroactive. So if you are currently on quarantine, and we've already put you on a quarantine, even if it was yesterday, the 10 day is not retroactive. It will start from today, the 28th. So anybody that's put on today, December 28th, going forward, it's 10 days. So that was a change that was made. And there was also some other guidance and regulations that came out in reference to healthcare workers and different sections of healthcare workers being able to return to work if they were asymptomatic and use of full PPE. So we are working to get that information out to the community. Literally, we were on the call with the hospital at 11:30, and those two pieces of information came in. So I haven't even had them in my possession for 2 full hours to really review and go through them. But, that's great news for some of our businesses and our hospital, the county, when we have county employees who are out, and for the school districts, if you're exposed, that quarantine does get cut down at this point to 10 days, which is great news.
Yeah, certainly makes things a little easier, but it really doesn't change. I mean, if you're involved specifically and you're dealing with a quarantine, it's changes. But for most people out there, I think it doesn't change a whole lot. You have to please try to remember that the choices that we make as a community as a whole will have a very big impact on nurses on the front line, administrators at the hospital, people that need care, and things of that nature. So,
and I've said this to you. I think one of my biggest fears is finding nurses.
yeah,
People say to us all the time, they would be more than willing to help us and volunteer and do some of the legwork. The things that we need are nurses. And they're in short supply at this point.
yeah.
And we appreciate the calls and people emailing me asking me if they can help come in and file and make photocopies, and those are the things I have people for. What we can't find across the state are licensed registered nurses who have the capacity to do the patient care aspect of what's needed. And I worry about the nurses that we do have if they get sick. Or I have a friend in my personal life who just completely left the nursing field.
Yeah.
She, 2 weeks ago, just left her job completely as a nurse because it's very difficult to maintain what we're asking our healthcare professionals to do.
It's a challenge, no doubt. Just to give some of the latest to back up, some facts behind what we're saying, just so we're not just pulling out information here. Right now, as a region in the Mohawk Valley, which I think it's important to think regionally because the hospitals really do work together. We were told today that they've now moved to, moving patients twice a day, and as compared to once a day previously, in order to try to use the entire capacity within the region. But there are 132 ICU beds within the region, and occupied of those beds is 99. So available is 27% within the region. So those are the latest numbers. I know it varies from county to county and hospital to hospital, but that's where we're at. as far as the region goes.
And Matt, when you talk about the region, can you just let people know what our region is?
Sure,
Because I think that'll give people some perspective how
sure.
big our region
It's
is.
Fulton, Montgomery, Schoharie, Otsego, Herkimer, and Oneida. So within our region, Oneida County is sort of the eldest child, the one that has the biggest population, and there's certainly kind of like the Albany County of the capital region, and then you have a number of other smaller counties that really have similar experiences, and a lot of times Otsego, Schoharie, Fulton, and Montgomery oftentimes have different challenges than in Oneida, but we all kind of pull together, and we still have our calls. Now it's Monday, Wednesday, Friday. With that, the regional calls, as well as our call with the hospitals on Monday, and now we're going to be having a call with the state every Monday as well to plan the vaccine distribution. Morgan, what was the number? 29,000 vaccines have been distributed within the Mohawk Valley. Again, it's going to be this phased approach. Right now, it's a very, very specific group of people that are going to get them. And as they come in, they're getting done. We're planning for more of that widespread community vaccination, which is not going to be for weeks, maybe months, or a couple months, I should say, at the most. But and with all that going on, I know, Sheriff, it was the holidays, and most people behaved. Some didn't.
Yeah,
Some
some
were on
did,
the
some
nice
didn't.
list, some were on the naughty list. But
Pause complaints were limited though, so that
I
was
did
helpful.
see we did get a positive complaint on Santa Claus.
Yeah,
Did you see that
I
one?
did see that one.
I thought that was interesting. But
Didn't want Santa to hand out COVID.
yes, I think we all want to make sure even Santa is safe.
Yes.
But everything else, anything on a serious note to update? I know you
No.
guys have been handling your work very business-like as always.
Yeah, everything is good. I mean, we're handling the calls as they come in, and we were happy that the pause complaints were decreased this weekend, which made it easier to handle some of the law enforcement things that came up.
And you did have a few,
We had a few
Incidents.
that were involved.
so, well, good job as always. I know
Thank
your team works hard. That's really, I mean, I could go on and on, but I guess we'll take a minute to see what kind of questions we have and take it from there. I don't know if I've even said it, but the total number now for us is 1,171, which is up 231 from the previous week, which is our biggest weekly total. And again, we did have some of, I think, our biggest daily total during this week as well. So,
And for me to have 4 fatalities in 1 week is heartbreaking,
no doubt
to
about
say
it.
the least.
When do you see the county going into a color zone?
I think I've been saying it's imminent now for, I think, a week or two. I'm again surprised it didn't happen today. Like I said, we still do have capacity. That number was 27%. So that's why we aren't there now. But from what I'm hearing, not only from our local hospital, but from others in the region, is that capacity is dwindling. So again, it's just a guess. You don't know till the governor puts it out there. But I'd be shocked if within a week we weren't in a designated zone. But I've been wrong before.
Kudos to your public health team. My question for you, Executive Ossenfor, is what are you as executive doing to aid that team in this county and coming out from under the backlog of tracing that is obviously contributing to the increase in spread based on unawareness that people are even exposed?
Sure. Well, the best way I can describe it is I try to stay in my lane and I try to fulfill the requests of the public health director. So, we did just recently add some staff. As far as adding positions to the department, we are having, discussions about, what the state can do, what we can do. But the bottom line is, I don't try to micromanage or tell a department head who has a very specific skill set how to do their job better. I'm here to fulfill requests and to be supportive. And sometimes that comes in the line of staff. Sometimes that comes in the line of coffee, which happened this morning.
Yes.
Just having conversations, getting help from other departments. The bottom line with the tracing and tracking, and I don't want to speak out of turn here, it's almost insurmountable at this point. And every county's in the same boat. There's another example as you talk to other executives, other county administrators of how they're handling it. The bottom line is everybody is really backed up and having a very difficult time with it. And we're trying to do everything we can, but it's tough. But really, it's being supportive of the people that are the experts. And I don't pretend to know more about public health than Sarah. So when Sarah, asks for help, we get it to her.
And Matt has been great. I mean, we put up for a new position, and that was because we had a very lengthy conversation as to what the future needs of the department are. We have pulled staff from other departments. Matt's executive team, Nancy, and even you, Morgan, are handling all of our press issues. Nancy has helped us with paperwork and filing and photocopies. So there's more to what Matt's team is doing for us than just tracking and tracing. That's a very specific skill set. So that other stuff that anybody can do, even the sheriff's office. I've called Jeff and asked him to take care of making deliveries. Emergency management, I don't make deliveries anymore. Rick Sager and Jeff Kaiser are handling all of our deliveries. So that wouldn't have happened if Matt hadn't helped me and take that initiative to get other jobs pushed out to other departments.
Basically, we try to be good teammates, and we try to support each other and help each other and be there for each other, and that's how our team operates. And that's what we do. We're going to continue to do it. But also, even with the tracking and tracing, there's some things we can't do anything about.
Right.
Other counties are backlogged too, so when we get information late, it just puts us back in the process. So it's going to I will always be very bluntly honest. It's going to continue to be a challenge. I don't see any way, especially when within 2 weeks we've had 449 cases. The amount of work that is just involved in that is just, this is nothing even remotely close to what we went through in March.
And there are days when we get caught up, we'll have, last week we had, knock on wood, one day we only had 12 new cases. We got caught up, and then the next day we hit 63 cases in one day. So.
And what I would say is, if you're concerned about, and I'm sure this person sounds very, genuine, and for people like that and other people in the community that are wondering what they can do, really, and this is what the conversation was with the hospital this morning, what people in general can do to help is limit those gatherings, because that's where we're having larger issues, lots of cases, lots of tracking and tracing, lots of phone numbers to be found and called, and we all have to do our part, and there isn't no one perfect solution that's just going to change things like this, but if we all pitch in, we can manage it a lot better.
First responders in surrounding counties are getting vaccinated. When is Montgomery County going to start doing the same?
That's happening. That's part of the 29,000. There isn't, again, as the vaccines come in, they're being pushed out. So it's going to go by that list, that 1A, that 1B category. So if you haven't been already and you are a first responder, it will happen. I don't know if Sheriff, you have any inside information other than some of the general points I've spoken to about the hospital, because I know you're that involved.
Yeah, just the consistency of your message and Rick from Emergency Management's message, and knowing that there's a specific list of first responders that get them first, and that's how it's happening.
Yeah.
And I have spoken to Chief Tony Agresta with the Amsterdam Fire Department, and him and I had a very lengthy conversation in reference to him and some of his staff who are paramedics and first line responders for the city being on that list, and they actually told me when they were going to get their vaccines, so they had been given dates.
It is happening, but there are
vaccinated.
some that are still waiting, and that's what I say. This is going to be a process. This is something that's going to take months, and there's going to be a very clear order of who's going to get what when. And we were even talking with the hospital today. There's even folks that are at the hospital that are in certain situations where they really need to get that and haven't gotten it yet. But as soon as they come in, they're getting pushed out as fast as possible. I'd like to also thank St. Mary's for taking on that task and really being a leader and doing. It's a lot of work to get that going. And what people don't realize is you can't just line people up, shot, go, shot. There's a period of time after, sometimes 15 minutes to 30 minutes when you have to watch. So that's what people within the region have been struggling with. They may be able to get the vaccine done, but where are they going to stage, all these people that are getting the vaccine after they got the vaccine, and space becomes an issue. So just like everything, COVID is, certainly has some very serious public health consequences.
And there's an assessment that needs to
Yeah.
happen before these
Yeah.
folks are vaccinated. So it's not, as you said, you back in the military, you pull the cap off, you jab and go.
Yeah.
You have to do a medical assessment with somebody. You have to find out do they have high blood pressure? Do they have diabetes?
Allergies.
It's allergies. What are some of their medical conditions before they even meet that qualification to become vaccinated?
I've said it for a while now. COVID has become just as much a logistical issue as it has a public health issue. Whether it's the snow plows or staffing a jail or running a DMV or whatever it may be, it's logistically created a lot of challenges.
If someone had tested positive and they were at a Christmas party, does everyone at that party need to quarantine?
Yes.
I think we err on the side of caution at this point, right?
Absolutely.
I mean, if this was the middle of the summer and we were below a 1% positive rate and half of the party was outside, it might be a different story, but it's wintertime, everybody was inside, and we just had over 400, almost 450 cases in 2 weeks.
If a person was exposed, how long are they considered contagious? If we don't show any symptoms, do we still need to be tested?
So there's two questions there. So a person can be contagious throughout their entire 10-day period of quarantine or isolation. That's why it's 10-day. We have people who start showing symptoms at day 7, day 8, day 9 into their quarantine. You don't need to be tested. It's not a requirement. You don't have to be tested. No one is forcing anybody who's been exposed or is displaying symptoms to be tested. But more often than not, people are asking for testing so that they know, so they can share that information with their friends and family and let them know, hey, I had, these symptoms and now I am positive, and then we can do the tracking and tracing from there. But it is not a requirement to be tested. It's a good idea.
Could you repeat the ICU capacity at St. Mary's?
So what I gave was the capacity for the region. The region total beds, and again, I say the region because these hospitals do work together, and like I said, there's transports from one to another. It's happening twice a day at St. Mary's. Within the region, we have 132 beds. Of those beds, 99 are occupied, and 27% are available. Now, I will tell you this, these were the notes from our last control room call, and I would be willing to bet that 27% has shrunk from the point in which this was distributed till now. So, but that gives you a general idea of where we are. There was a point on these calls where that number, that percentage was much, much higher. So you can see the trends, as part of the way they're happening. And just if people are interested, bed capacity, total bed, we have 30% of hospital beds available in the region right when this came out, and currently within the region, 211 COVID patients in the hospital, which for the region, that's 0.04%.
Do we know what percentage of our increase is due to travel?
I have those numbers not with me. I didn't bring them and I don't want to guess, but I was listening to the update over the weekend, and we had 1.8 million travelers travel in and out of New York State this holiday weekend. Between the 24th and the 27th, they estimated 1.8 million travelers in and out of New York.
And travelers is certainly a big component and important, but I would also stress, and please correct me if I'm wrong, that right now we're seeing pretty common just community spread.
Absolutely.
There was a point where we were very much more concerned about travelers because our numbers were low, worrying about our numbers going up. But right now our numbers are up. When you're at 8, 9, 10% positive percentages for your daily numbers or your rolling averages, it's a pretty clear indication that it's here. And
right.
It's not just the travelers. So that's why really the shift in the messaging is focusing on reducing gatherings and if for nothing else, to try to make it a little bit easier on our frontline nurses, our hospital workers, our nursing home folks, and just trying to make those decisions. That's where we're at right now.
Is it an employer's responsibility to let an employee know if a coworker tests positive? And if it is, what happens if they do not?
So let me try this. So it's a complicated answer because there are HIPAA privacy concerns. They are responsible to address it professionally and appropriately, but they are not responsible to tell them exactly who has it because they can't because of HIPAA privacy laws. Is that correct?
That is correct.
And you will have differences from business to business to business. So for example, the county or the school district might look a little different than a small business with 5 employees or a bank. I had a call from someone I know about, what was happening at the bank. And it was clear something was happening at the bank because there was a number of people out and so on and so forth. And what are the requirements? What do they have to tell you? But the thing that makes it very tricky is there are some very strict privacy laws that have to be respected.
And typically what our bigger businesses are saying is that we've had an exposure and you will be contacted by public health if you are a direct contact or a close contact. And most of our businesses are putting out notification to their employees because cleaning will happen. People are be coming in to wipe down desks and equipment, but they have been really great, most of our businesses, about that. We've had a couple that have struggled, but they're doing really well.
Which is to be expected.
How far behind is the Department of Health on calling positive cases?
So we are currently working on Friday, which was Christmas. So we had 63 patients come in on Friday. So we are working on Friday.
In the past, it has been mentioned that pause complaints are just being issued warnings. Would you suggest that people are wasting their time and yours by submitting them?
Not at all. I think that is the appropriate function, and they are being followed up on, and great majority of people are doing the right thing, as we've seen. But no, I mean that's the appropriate way to do it.
No, definitely they're not wasting their time. I mean, we either send the agency responsible for the jurisdiction or we go ourselves and we educate staff there, managerial staff most of the time, and the problem gets corrected.
Yeah. I would say what we do ask is that you don't call public health with those complaints. Quite frankly, at this point, those calls will either be given to my office, but it's on the priority list in public health. It would be great if you have a complaint to do New York Pause, or I get emails all the time, phone calls as you do, and we try to follow up on them the best we can. But it's never a waste of time.
No, definitely not. But sometimes the pause complaints are almost impossible for something to be done. There was a gentleman in aisle 6 in a store that wasn't wearing a mask properly, was under his nose. Well, by the time that complaint comes in, it's hours later.
Yeah, and you get it. Yeah, exactly. That person has left the store and long gone. But there's still a conversation that happens with the store.
Absolutely.
And
trying to encourage staff to educate the people when they come in, and
well,
all of that helps us reduce the numbers.
Absolutely.
Hopefully.
How long before school personnel will receive the vaccine? Do we know any time frame for that yet?
Well, we do know that school personnel was included in some of the more earlier categories.
School nurses were obviously a part of that.
But I know that has been a priority. We know what the list of groups that in the order that they're going to be done. We don't know the exact dates in which they're going to be done because they're basically getting done as soon as the vaccines get in. And then once they're complete, we move on to the next list. So I would say, if I had to guess right now, it's going to still probably be a few weeks minimum. But that is, again, I have not heard a specific date, but what I'm stressing to people is the vaccination process is going to take some time. Even within schools, I imagine there'll be a prioritization of those who are have more exposure to people who are maybe have some health risks or maybe are older. Mm-hmm. So, and that stuff is still being worked out with the state, with the local superintendents. There's a lot those are what the discussions are, a lot on our our control room calls. Now we're going to have a weekly call with the state on addressing those issues. So as we know a specific date, we'll let people know. We don't know one now, but I would just stress it's going to take some time.
You and I had this conversation one day last week. People in Matt's position or my position, we are not even a category. Public health directors, county executives, we are not a category.
Yeah.
At this point.
Yeah, and it's very specific. I mean, and where we're at right now is there's still people, that are frontline workers that have not gotten it yet and need it. So it's, once that first 1A category gets taken care of, and I don't actually have the list in front of me, but I know school personnel was, to some surprise, really included very high on the list. So that was encouraging to me.
Someone else asked what the group is that's receiving the shot at this time and future groups, but we can
We're just in 1A right now.
Yeah,
I mean, we're in the first level right now, and that's going to, I think one of the folks I believe said that I want to say it was 3 weeks to get through 1A and get into 1B was one of the projections by one of the hospital administrators within the control room. But again, things change. It depends on supply of vaccines. It depends on the ability to distribute effectively and safely.
And it's also a 2-series shot. So
yes.
We're going to get 1A taken care of in a very specific order because within that group, there were people who were priority in that group. And then they can't get to 1B until 1A has received the second vaccine. So there's, it's very thoughtful and it's a stringent
rigid,
process.
I would say, very rigid, and it's going to take some time. And we were just having conversations before we got here about our efforts to try to have community-based vaccine clinic and what we're going to do there. And it's a tall order, but we're going to do it. And we're going to try to pull everybody together, but it's going to take a while. It's not something that's going to be here next week. It's going to take a while to get through those first steps, and then when it gets time to open it up to a much broader scope, we will be ready.
Was the 27% you were mentioning ICU beds or total beds?
27% was ICU, and the percent of total hospital beds in the region is 30. And again, these are, from the end of last week and likely have been reduced further since then.
The beds that are being used, are they all people from our area or people from outside the region?
Right now, it's a local hospital filled with local people for the most part.
Yeah, and we have to remember that our 2 local hospitals, St. Mary's and Latour, there are a number of people in Montgomery County who use Latour services, and there are a number of people in Fulton County who use St. Mary's services. So just because you live in Montgomery County doesn't mean you only use St. Mary's, or just because you live in Fulton County doesn't mean you only use Latour.
Or if you're in the Western County and part of the county, you use Bassett. So that's why I really like to look at the regional numbers.
Absolutely. I think it makes more sense to look at a regional perspective
and
because our counties
they're all working together. And that's the thing that I find the most impressive is just the, how much that cooperation is stressed by these hospital administrators. We had a call last week with all the hospital CEOs, all the public health department directors, and really, I mean, it's a cohesive group of people that know each other and work very well together. So if one has a need and the other one can help, that cooperational type of relationship exists.
Yeah, and we've worked on a number of projects with Nathan Latour Hospital.
Yeah.
So.
Is there a meeting scheduled with the superintendents this week? Parents will need some time to prepare. Students may be continuing remotely.
I don't have that at this point. That is something we had talked about, but we really wanted to make sure we had a good grasp on what our numbers looked like and what we were coming off of. And now with quarantines being changed to 10 days, it might be a completely different conversation. But that is certainly something Morgan can help us organize.
Yeah, and listen, I know I speak to Dave Ziskin regularly and a number of the superintendents, and it varies district to district. Not every district in the county, even within the county, is experiencing the same exact thing. But I mean, I think the more communication you can have with whether it's parents or caregivers is important. I know it's hard on the teachers. I mean, it's hard on everyone, really.
Just wondering, when you do contact tracing, do you ask people if they did wear a mask, etc.? I know that some people won't necessarily tell the truth, but what kinds of questions are asked when you call?
We certainly do. We ask people, where you were, who were you with, did you have on a mask? If people are in their home, typically they're not wearing a mask. If they were out in public or they were at a medical facility, they were in a store. I would say 90% of the time people say, yes, I was at my doctor's office or the medical office or wherever wearing a mask. In homes, people typically are not. And as Matt has said, and we've talked about, what we're finding more and more is this is in-home spread. It's a wife that works in the healthcare field and she comes home and her husband and children are now positive, or they had a small family dinner and one person was sick.
Or a large family dinner.
Or large family dinners. We've had those.
Get-togethers. That's what we're seeing. I mean, it was stressed by the hospitals today, or the hospital today, and I would agree. And it's similar in other, when kids are in school, when you're in, professional environments, the rules are being followed. It's in the private. That's where you're seeing it happen. No doubt about it.
But we ask lots of questions. Were you wearing a mask? How far apart were you? Were you eating? Were you drinking? Were you sharing? If they were having a meal, did you pass plates? So there's very, very specific questions we ask about exposure.
Which is why it takes a long time too.
One phone call can take about 45 minutes.
Is the vaccine going to be optional or mandatory?
Well, it depends. I think it's certainly going to be optional in many regards. I think there'll be various circumstances where if you want to do something, it will be mandatory. Like I've even heard, things like going to a concert next summer, like they're going to look for proof that you got a vaccine and things of that nature. So it'll be a personal choice for a lot of people. I imagine there'll be some circumstances with employers where there will be a mandatory in nature, but it's not just one answer that it's mandatory for the entire population. That's not what's happening.
Right.
This is still America. But I think for a lot of people, it's going to be a very personal decision.
Absolutely.
And you actually have seen some of the poll numbers go as time is going by. People are starting to get a little bit more comfortable with it. Any questions for the sheriff?
The governor at his daily briefings states that regions, etc., are in control of their own destiny. If that is true, why do we need the state's direction before a region takes action? The county exec and departments continue to ask residents to follow the guidelines. Apparently, these guidelines are not being followed. Bottom line, is it up to the state to make our next step? Like the majority of our area, gratitude for all you do and your honesty.
Well, thank you. I think here's the challenge right now is the restriction piece of it and shutting down businesses and things of that nature, schools, things that are really vital to the area are tough decisions and quite frankly not where we're seeing the majority of the spread. Where we're seeing the majority of the spread are in people's homes. So no matter how many restrictions you have or try to put in place, it's not going to solve the challenge that's before us, which is the personal decisions that people make. So, we saw what happened when the governor tried to limit the number of people at Thanksgiving dinner. And I think it almost actually had the opposite effect where people wanted to defy it just because you're not going to tell me what to do in my own home. I don't think, certainly I am not. I'm the type that is going to say, this is where we're at. We need the community to pull together. We're going to get through this. It's just a matter of, do we make it a little easier on ourselves by making some better choices? So I think that's certainly the method we're trying to take. I do think that, some of the restrictions related to, houses of worship, indoor and outdoor dining, schools, back to gyms, fitness centers, hair salons, personal care services, a lot of that stuff is probably going to come. I'm surprised it hasn't already. So rather than reinvent that wheel, I think, we'll certainly, do our best to get that information out to people of what the recommendations are, because really right now it's focused on the capacity to treat, and we have had the capacity to treat, but we are very much in our in control of where things go in a lot of ways, but everybody's got to do their part. And I just don't believe heavy-handed restrictions is going to change a lot of that because, even again, like we were talking about, if you go to a funeral and everybody follows the rules in the church, but doesn't follow the rules in the parking lot or at the a gathering after, it's really not going to make a whole lot of difference. So that's why we've been stressing now for a few weeks that the community has a large role to play here. And I don't know if I'm rambling, but I really believe that that is the best way to approach this because I've also seen the pain that comes with the shutdown and the restrictions and talking to business owners that have lost what they've worked for years. And people that are out of work and unemployed and dealing with kids that are home, working remotely. It's a challenging issue for sure.
Part two of that is enforcement, right? So
There you go, Sheriff.
we have the ability to enforce some of these public health laws.
Mm-hmm.
And we've decided to take each case on its merits and do a true investigation into whether someone warrants or deserves to be ticketed. And up to this point, we haven't felt that they have. But, it's very, like, some groups want certain types of individuals to be ticketed, but it doesn't work that way. We either are going to issue tickets for something involved with public health law during a pandemic or we're not. It's not, well, we can just do it to certain people and not others.
Yeah, and I don't think people really, like you say, you're going to have that consistency across the board and, just writing tickets all over the county.
We've erred on the side of caution and we've supported the people in our community. And for the most part, when we go talk to people in the community, they're supportive of the rules. They understand the concepts and why they're in place, and they're cooperative. And that, to us, that's half the battle or 3/4 of the battle.
Yeah.
And it's just unfortunate that it's spreading now.
Mm-hmm.
And some of the public health laws don't necessarily pertain to the in-home situations compared to
and that's where you're seeing the biggest issues. And I would also say that, as I talk to other executives like a Dan McCoy in Albany County or a Tony Picente in Oneida County, being a small rural county has its benefits. And one of the biggest benefits is that you can handle things on a case-by-case basis because you're not just getting sent off into an area where you don't know who these people are. We know who these people are, whether it's a business owner or residents or whatever it may be. So we try to be thoughtful and handle those things in that way. So.
And I have said it before, that doesn't mean we're afraid to issue
Yeah.
tickets. Believe me, if we're put in that position, we will issue tickets.
And we've had a couple instances where the state has got involved and there has been some legalities and.
We are not afraid to do our jobs. We're just trying to do them properly and appropriately during this and not affect people in a negative way.
But I will say, I think we're within the realm of comparability with other areas. Yes, the Mohawk Valley is a little bit higher right now. A lot of that, quite frankly, is in Oneida County where they're already in a yellow zone. We've seen some big numbers out of Fulton County recently. But, when you look at what's happening in upstate New York, we're really all in the same boat for the most part. There's some subtle differences here and there. But, there was a point where we were all under 1% percent positives for the day, and now we're all up in the 7, 8, 9, 10 range. So the real key for now is, can we keep it in the 7, 8, 9, 10 and not let it get to 15, or can we even maybe try to get it reduce it a little bit, and that's the biggest thing that's going to have an impact on that are the choices that people make.
Are the 22 fatalities we have mostly nursing home patients?
So I would say just as a general, right, 2/3, 75% are nursing home, but I will say in the last week it was 50-50. We had 4 new ones, 2 were in nursing homes and 2 were more community-based, or non-nursing homes.
Non-nursing.
Is the better way to say it.
Have there been any reports of cases from hotel or motel stays, etc.?
No, thank goodness.
Yeah, I haven't heard that.
No, don't jinx me.
Why were larger areas like Western New York able to bring down their positivity rates? Has there been communication with other areas on what they have done to bring their rates down?
Yeah, I'm sure they're talking about Erie County, it was, it's a much more heavily populated area. I would say there's some differences there. That's what the point of being in the control room is all about, is sharing and understanding what others are doing. I certainly have relationships through the Executives Association and some of our other colleagues and the public health directors, and we're all looking for best practices and trying to do our best. And you know, we've settled generally. I mean, as we've said, this is 289. You know, we don't want to also overthink it. You know, really what we're seeing and we're telling you is the honest truth is that where you're seeing a lot of the numbers grow exponentially are, you know, mostly gatherings in private residences, not, you know, the schools, the gyms, the tanning salons, the hairdressers, even the restaurants. You know, when you look at some of the data that's out there for these types of entities that have protocols to follow, you're seeing low transmission rates. But when you talk about, you know, everybody's getting together, having a few pops at a family function, that's where you're seeing half the family, right? Is that fair?
Absolutely. And I think for me, I've said, you know, we are always behind what happens from the southern part of the state and the western part of the state. So when we look at, and I'll take COVID out of this, when we had the measles outbreak back last summer, we followed the trends that were coming up from New York City and coming from the western part, and we were insulated in the middle of the state. So we were fortunate enough that we didn't have the explosion of measles cases. But I think this is one of those times where the southern part of the state, Long Island, New York City, Westchester, Dutchess, they were exploding at one point, and the western part of the county was exploding. And now, because of where we are now experiencing that explosion in cases, whereas the rest of the state is settling down. So even when we look at trends for other types of illnesses, diseases, things we track and trace, Lyme is another perfect example. We are typically always centrally located in between those cases that come up from the southern part of the state and down from the western part of the state.
There's a lot of larger forces at play. And I mean, even if when you look within our region, the areas that I guess you could say straddle the thruway, all have similar numbers. And the one county that is a little bit lower within the region is Otsego, which is a little bit more off the beaten path. But, you know, you look at the numbers, the rolling averages in Fulton, and you're at 9.1 for the 7-day and 8.4 for the 14-day. You look at Herkimer, they're at 8.3 for the 7-day, 8.1 for the 14-day. We're at 8.9 for the 7-day, 7.4 for the 14-day. Oneida, same thing, 9.1, 8.9. Schoharie, you know, a little bit lower on the 7-day, 5.8, but still 8.4 on the 14-day. So a lot of this is really, you know, the way people move and the types of communities you live in. And, you know, we're experiencing what a lot of other communities are experiencing.
Is it true that people are still getting COVID while wearing a mask? Is that possible?
We have had people who have said, you know, I was with this person and I was wearing a mask. We see it in the hospitals, you know, with nursing home workers, hospital workers, everybody wears a mask. It is still possible. I mean, anything is possible, but does it help to protect yourself? Absolutely. And does it help to protect other people? Absolutely.
And when your numbers are like this, it's possible that may not even have been the interaction.
Correct.
It definitely decreases the percentages of likelihood.
Definitely
It
helps.
does.
Yeah.
The fatalities in the county, did they have pre-existing health conditions or was it just COVID related?
Each case is very different depending on what the condition is, but there were cases that did not have pre-existing health conditions.
Well, and I will say we did have a couple, and again, with respect to privacy issues, I will say generally we have had a couple of cases recently that were on the younger side of what we've seen.
Absolutely.
Can you guys just explain once again, you're talking about getting a vaccine, if either of you have had a vaccine yet, and when will you become eligible to do so?
Oh,
The three of us sitting at this table are not on the list. We are not even considered a priority as a public health director, and I'm not a nurse. I'm not considered a priority. Matt is not a priority, and the sheriff is not a priority. Even as law enforcement, he is not on a category.
also for me, I think part of it is, you know, in the position that I hold, I'm going to get it as soon as possible, which is why I was, you know, because of the challenges and the skepticism. But Sarah's exactly right. There's a lot of people that aren't on the list right now. And like, for example, one of the questions we asked, okay, we're going to be doing and looking to do a community type vaccination pod or clinic, and however the terminology is. But what about our nurses? They can't get the vaccine that day. They need to get the vaccine ahead of time, or whoever is going to be doing the shots. That has to be done ahead of time. Those people were not on the list.
Right, and
Which is
even
one of our
when we
concerns
host
as
a
a small
pod,
county.
so looking at the sheriff, I'll give you a perfect example. Jeff deploys deputies and staff to our pods when we have a vaccine that we're handing out or we're administering, I'm sorry, to the community because we need to have security there. But at this point, law enforcement, Jeff is not on that list. So if I was going to host a pod or to do a community-based vaccine, I would have no security there because I can't have an open pod with no security and people who are not vaccinated. So we have to vaccinate the people who are going to be giving the vaccines before we can even look at that. And the three of us sitting at this table are not on a category.
No, but if I had it, I would take it right now. And again, it's logistics. It's a public health issue, no doubt about it. But everything else, as far as dealing with this, is just always logistics.
Has anyone reached out to the Amish community in the area?
I can speak for the whole team that there have been a number of conversations. I believe there's 5 different Amish organizations, all with different elders. Conversations have been had. I know Sarah had a now infamous visit out to a farm and trying to help some folks that needed help. Those conversations are ongoing. I mean, I don't know if you'd like to add anything to that.
Yeah, we definitely, early on in this, I want to say it was April. Sarah, do you remember?
It was April.
We traveled around and we updated all of our contact lists with all the elders and made sure we had the proper information, and we communicate regularly, both public health and the sheriff's office.
And I will say that October, which is a season of lots of weddings, was certainly a very busy time in which there was a lot of communication going on.
Yes.
So, yeah, I mean, it's been a regular, you work with the communities that you
They've
have.
even called early on and got permission through Ag and Markets to hold some of their auctions,
Yep.
Right.
Things like
We've
that.
provided supplies.
Right.
We were asked if we could translate into Spanish. I think we might be able to update our settings to do that for people.
It could be a possibility. It depends on Facebook's settings.
Yeah, we can try. And also,
Like our posts, they want our posts translated into Spanish,
I'm not
or
sure.
they want me to speak Spanish.
well, I think
I'm not
maybe,
sure.
I'm assuming maybe the live stream, but
Oh, that's what I'm
also
thinking.
maybe we can look at some of our materials. I know, and I'm not sure if people have heard, but we're trying to get the audio from the live stream up on the radio because we've heard from a lot of seniors that they are not Facebooky and have a hard time watching it. So that's something that we're also trying to do. And thank you to our chairman, Joe Isabel, for helping with that, and getting it up on WCSS does allow it to be played countywide.
I'm working on that as fast as I can.
Thank you.
To actually get it to.
Thank you.
I haven't seen any Amish people wearing masks. How much does this affect us, shopping in the same stores, etc.?
Well, for most of the stores, I know they're not allowed in. I mean, I know we were just at our small business of the month.
I saw a lot of them wearing
in
them.
Fort Plain, and there's big sign on the door, and I didn't see anybody without them, and that's English or Amish. So, yeah, again, if there's an issue and that needs to be followed up on, put the pause complaint in, and Jeff will have someone from the team pay a visit. Good. Sarah, any parting words?
I'll steal the sheriff's thunder. If you are going to be out on New Year's Eve, please don't drink and drive. We do more at the public health department than just COVID. So part of our injury prevention this year is to drive responsibly, call a friend, family to pick you up if you have been drinking.
Sure.
I'll do one better. Don't go out on New Year's Eve.
Yeah.
He always has to one up me.
Well,
Just enjoy responsibly, please, and regardless of whether you're out or getting together, try to follow the guidelines and be a part of the solution, not part of the problem.
yeah, and following the guidelines is not, an indication of, your personal opinion on COVID
Right.
and all that other stuff that has
Respect
been
for
hotly
others.
debated. If you're going to do it for anything, do it for our nurses that are frontline workers and our hospital staff and the kids that really just want to get into school. And, it will have an impact. You can push the needle in the direction with some of those choices. So I certainly echo that. I hope everybody had a really great holiday. and got to spend some time, whether it was Zoom or otherwise. But as you head to, New Year's, just keep what we said in mind. Hopefully,
We'll see you in 2021.
yes,
See you next year.
unless something really, serious happens. Hopefully, we'll be back Monday. It'll be a new year, and we'll keep going. But thank you everybody for tuning in. Please share so other people can get up to speed with what's going on, and hopefully everything goes well. We'll see you next Monday. Thanks.
Thank you.